Did it have to come to this? That is the question, as doctors will now be able to essentially decide who gets what level of care. And this comes as the state gives hospitals the chance to activate their crisis standards of care plan. ABC 15 reporter Nicole Grigg says this will put hard decisions on doctors right now. Nicole?
Steve, this is a decision that doctors don't want to have to make, where they could essentially have to decide who lives and who dies. It's all based off of math and algorithms. Now, this is the state's new crisis standards of care plan. It's a 14-page document that says hospitals have the ability to use a type of scoring system to determine who gets what type of care. The state saying not every hospital is at this level, but the ones that are can make those hard decisions with some liability protections too. Here's my exchange with the governor. Governor, healthcare professionals are telling us that your negligence in opening the state early, those are their words, not mine, have put them in an impossible position of having to soon decide who lives and who dies. How do you respond to them?
Well, the first thing I want to say is we've been focused for 3 months for what is coming at us right now. Of course, you're always hopeful that something like this is going to pass, but it is in front of us, and it's time for Arizona to act. In terms of the plans that Dr. Chris just talked of, in terms of backup and staffing that can be brought to the fore, the surge capacity that we have if necessary. It's not needed today, but we're anticipating that it will be there in the future. This is our time to act to save and protect as many Arizona lives as possible.
But if we would have followed the proper protocols to open correctly when we were supposed to, doctors wouldn't have to decide who dies.
We did. If you look back to the stay home, stay healthy, stay connected order, and when it was ended on May 15th, 6 weeks of asking Arizonans for dramatic sacrifice, the virus in Arizona was slowed to a crawl. We can go back to where we were in terms of slowing the virus, but in terms of what we were planning for and preparing for was if we were hit hard with this pandemic, and we are prepared.
Also on the staffing front, Dr. Kara Chris saying that they have asked the feds for help to bring in nurses and doctors. They're also working on a national contract too to try to help staff some of these hospitals. Reporting live in Phoenix, Nicole Grigg, ABC 15, Arizona.